Okay, so this project, I'm going to be talking about the timeline of telepractice. So, telepractice is the application of telecommunications technology in the delivery of services at a distance. So, what it does is it links the clinician, so like the speech path or the audiologist, to the client for assessment, intervention, and or consultation. And so telepractice has to include the same quality of services that the clinician would provide in person. So they would have to follow all the national, state, and professional guidelines like the Code of Ethics, different state and federal laws, and OSHA policies that they would have to stick to when they were in person. And there's not really a limit to where telepractice can be used or implemented. It can be done through schools, hospitals, rehab centers, at your house, or maybe even through your daycare. And as long as all the policies and laws are followed, you can practice telepractice anywhere. So, the idea of telepractice started with telecommunication technology, and most of the first practices used were for medicine. And telemedicine was how doctors and other professionals delivered diagnostic and treatment services over long distances. And so at the very beginning, they started with messengers who would run from place to place to pass on information from one person to the next. And then it moved to the telegraph and then to the telephone. And then finally, when the internet was invented, people were able to communicate a lot easier over long distances. And so all of these ways were used to communicate health information over long distances. And then in the 1900s, radio communication was a big thing, and it was widely used because different healthcare services could be provided at a distance, and medical professionals would use the radio to provide consultations to patients who were in remote locations, so they didn't have to be in person to be able to know what was going on with them or get help from a doctor. And then in the 1950s, the use of black and white televisions increased. So TVs gave the doctors the ability to actually visualize a patient's condition over just listening to like something over the phone or to an audio recording or something like that. And this really enhanced like the effectiveness of the diagnosis because they had something to actually look at alongside the audio so they could really see what was going on better. And then in the 1970s, they started seeing a lot of advancement in the field, especially in the speech path field. So in the mid 1970s, one of the first applications of telepractice delivery in speech language pathology happened at the Birmingham VA. And so what they were working on was the telecommunicology project. And this project developed a remote treatment and evaluation for people and patients with speech, language, and hearing disorders. And this was all done through the telephone. And this was a super important application of telepractice in the speech path field. And because it really showed how telepractice was useful and could be helpful in a lot of different situations. And it showed that you could still provide therapies and practice from a distance and you didn't always have to be in person and face to face. And then in 1987, a study was done to compare how good the diagnosis for speech disorders could be through telepractice. Some like controversies at the time where they didn't know if it was as good as in-person treatment and maybe like it would hinder the progress of the therapy of the patients if they were only doing it through telepractice. And so this study was done to just kind of test to see if it was actually as good or maybe better than in-person treatment. And so the three methods that they were testing in the study were in-person, telepractice with a closed circuit TV, and telepractice using a video laserdisc and a telephone system. So the closed circuit television system, it had real-time audio and video feeds, so it was transmitted across two rooms in real time. So it was kind of like how we have like FaceTime or Skype or Zoom now. And the Laserdisc system had the testing material recorded on the disc, and then it was later played for the client. So the speech path could record the lesson and then give it to the client later to do on their own. And the results of the study found that there was over a 90% agreement between the assessments. So it showed that like the effectiveness was pretty good and it was pretty consistent throughout all of the modes of assessment. And so this study really showed the potential usefulness for telepractice and proved that it could be helpful and that it was pretty much like in person, just remote. And then also in 1987, the Mayo Clinic started using telepractice to diagnose speech and language disorders. So through their program that they called telemedicine consultants, they used technology to connect the clinicians to the patients. And so through that technology, they were able to assess patients with speech disorders by doing like different oral exams, motor speech exams, and language testing all through like remotely through the computer. And so what they would do was that the SLPs could like give a lesson online and then the patient at their own home, maybe they would have the help of like an aide or a nurse or someone, and then they could help them through the different therapies or examining whatever they needed to do. And then also through this program, it allowed SLPs to connect at different locations. So SLPs at different locations could use the same like telemedicine technologies to collaborate and consult on cases with each other. And I think that brings another good point that telepractice isn't only used to treat clients, it can also be used between different professionals to talk about the work and get help from others when maybe they're far away from each other and it would be hard to in the past. And then the 1900s through today, so the internet has continued to expand and increase, and that has also led to the increased accessibility to telepractice. So there's a lot more better access to telecommunications technology like laptops and desktops and smartphones, so you don't really need like really expensive advanced technology in order to do this. And there's also a lot more availability in teleconferencing websites like Skype and FaceTime and Zoom. And these platforms make it really easy for clinicians to set up meetings with their clients, and they're pretty user friendly. So a lot of clients are able to kind of figure out how it works and be able to use them to the best of their ability. And then these expansions made telepractice delivery available to a lot more people. So video conferencing decreases the cost of more advanced equipment, and so the services can also be a lot more cost efficient. And so if you're not able, like you don't have an SLP in your area, or maybe you want to see a specific person, then this makes it a lot easier to do this and you won't have to drive a long time to do it or have to pay a lot more money for transportation or anything like that. Like it makes it a lot easier to communicate virtually. Okay, ASHA's role in telepractice. So in the late 1900s, or in the late 1990s, ASHA started studying the potential impacts and applications of video conferencing and distance learning technology in telepractice. And they started doing this because of how much telepractice was proving to be useful, and they wanted to show people like that it could be useful and they could use it as good as in-person practices. And then in 1998, ASHA published the Telehealth Issues Brief, and this taught its members how to actually apply telepractice in the field. So it was more step by step, and it just gave the professionals a way to like know how to use telehealth in their practice. And then from 2001 to 2003, they also put telepractice into their focused initiative on technology. And what the main purpose was that they wanted to better inform the members and help get people more familiar and comfortable with the use of telepractice. And this also helped others get access to different products and activities that they could use in their own telepractice and just kind of collaborate with other people and be able to see all the benefits of it. And then ASHA put out their approval for telepractice in 2005. And because there was such an increase in the use of telepractice, they developed more policies to really structure it and tell their clinicians how to use it in the best way. And they made it clear that telepractice services had to match the services that would be given in person. And this is a really important point because that was sort of a concern of the past, that if, like I talked about in the other slide, they were thinking that if you were doing it just online, it wouldn't be as effective as in person and that it would really hinder the progress of their patients. But they've proven that it doesn't really do that and that they're pretty much on an equal playing field. And then in 2008, ASHA developed an ad hoc committee on telepractice and speech-language pathology, and this committee included a group of speech-language pathologists and a rehabilitation engineer, and what they did is that they made a report called the Professional Issues in Telepractice for Speech-Language Pathologists, and they further outlined how telepractice can be used, and this really set the stage for clinicians to be better informed on the usefulness and just how they can use it in their own practice. And then in 2010, ASHA established the Telepractice Special Interest Group, and they started this group to get more focused attention on telepractice in speech path and audiology. And through this group, the members could share information and work together to solve problems that a lot of them are facing, like issues with telepractice and just some solutions that they found have worked for them. So in all these programs and policies that ASHA put out really showed the reliability of telepractice and helped establish it as an efficient way to deliver services. So the use of telepractice really increased due to the COVID-19 pandemic, and traditional in-person services were forced to shift to telepractice. And when the SLPs were using telepractice, both the SLP and the patient could stay safely distanced from each other and not be restricted by masks, and that's super important in that field because you want to be able to see the mouth, how it's moving, and how they're producing sounds. And so telepractice in the SLP field has been around for over 40 years, but it was not used very widely. Like, even though ASHA was giving their approval and stuff, people still preferred in-person. But with the pandemic, when people were forced to shift, it really showed the benefits of it and how it could be useful, and it was really proving to people like, yeah, this is a good way to practice SLP work and therapy. So there's 3 types of telepractice today: synchronous, asynchronous, and hybrid. So synchronous services are done in real time, and synchronous is most like the in-person experience because the clinician is there with the client through video and audio. They're connected via Zoom or Skype or whatever platform they want to use, and this is the most interactive platform. And synchronous services like video conferencing can support clients that don't have access to in-person SLP services. So even if you're not in a pandemic and you don't have to be at home, if your SLP lives far away, you can still be connected, or maybe in your area there's no SLPs that do what you want to work on, then synchronous can connect you to somebody that does really easily. And then asynchronous includes the clinician recording something on a video lesson and then sending it to the client, and then they do it on their own independently. And so asynchronous telepractice is also being used right now to help dysphagia therapy at home. So what the SLP does is they might record a lesson with different exercises that they're supposed to do, and then the client at their own home, maybe they also have the help of another nurse or someone at home to help them follow through with the practice. And so in this way, the SLP and the patient aren't really seeing each other face to face, even through Zoom or something like that, but they're still getting the lessons through to them that way. And so the hybrid type of telepractice is just a combination of synchronous and asynchronous. So there's a wide range of applications for telepractice today. You can use it to help treat communication disorders, fluency disorders, voice disorders, dysphagia, and childhood speech and language disorders, and there's a lot more that you can do with telepractice. Okay, so for my reflection, all of the benefits of telepractice were really shown during the height of the COVID-19 pandemic. So as I said before, ASHA did put out all of those policies and approvals that they really supported telepractice, but COVID really showed people yeah, this is something we should be doing and making use of. And so telepractice really allows more people to get access to services that might not have been available to them before. And as long as you have access to the internet, you have the possibility of meeting with a clinician online and doing therapy via like different video conferencing programs like through Zoom or Skype or whatever. And clinicians can also videotape themselves and have others watch it on their own time, so it's a lot more convenient if you have like a busy schedule or if you have kids and you're the patient, or maybe your kid is the patient and you have to work a lot. Having telepractice makes it really convenient because you can do it from your own home, but you can still get the same quality services. And this can really be useful in the future because it makes it a lot easier to meet with patients. So if someone is sick or they live far away, they'll get the same treatment but just in a little bit of a different format. And so overall, I've learned that telepractice can be used in a lot of different ways, and it can be it can be applied in a lot of different ways that can help people. And in my future as a speech path, it'll be useful to know all the different applications that are out there so I can use them with my future clients and get a better idea of what works best and how it can be used to help them. And then that's just why we're excited.